Should pharmacists join the ward round? If you are a hospital pharmacist, I really recommend trying to be part of the ward round if you can. It creates more of an MDT vibe. Otherwise, sometimes a pharmacist can just end up being like this like little rat in the corner of the ward. You know what I mean though, you know what I mean. I've kind of just made myself part of it. Like, they didn't have a pharmacist there before. And I've just been like, I'm going to join your ward round. I appreciate that it's not always possible, but there's definitely a benefit for the pharmacist and for the rest of the team. So the way that I do ward round is I'll basically try and do my drug histories and meds recs before starting. If not, I will just look at the GP record. So I'll already know if any of their regular meds need prescribing. While the doctors are examining the patient and speaking to the patient, I will bring my laptop with me and review the meds in real time. And it means that if I identify any issues, they can be dealt with then and there. If you're on the ward round, you have a reg or consultant available who can just give you an answer really quickly. And you have the patient there as well who can help with the holistic patient-centered decision making. By the time ward round has finished, I've seen all the patients on the ward as well. This does only really work if you either know your patients well or your patients are not super complicated and have like really long drug charts, because then it can get a bit messy. As a prescriber, I feel like I can contribute a lot more to the ward round now. Say if I know that some of their regular meds are missing, I can just be like, I'm going to prescribe you regular meds. Say if they are in AKI and they're on metformin, I can just go ahead and pause that metformin and like do this all with the rest of the team there so everyone knows what's happening. The benefit for the team is that they have pharmacy input right in front of them. Say if they want to prescribe a new medication, I can check if it's in stock. I can check if it's not in stock, what's available instead. If they want to give an antibiotic, I can check the antimicrobial guidelines and make sure the right one gets prescribed at the right dose and right duration and right everything else as well. I feel like nurses and doctors might not be used to having a pharmacist on a ward round because from my experience, it doesn't happen that often. However, if you do start doing it and you like continuously do it and you show the benefits of having a pharmacist, the rest of the team will really appreciate it.